Hello friends. So in our previous class we have seen some muscles, ligaments, membranes and all. Now we must understand the functions of larynx. So mainly the main functions of the larynx, how the muscles, which muscles are responsible for the respected movements, different movements. So we can see three major functions. One is opening or closing of the laryngeal inlet, and next one is abduction and adduction of the vocal cords, or increase or decrease in the tension of the vocal cords. These are the three main functions we are going to see. Muscles that open or close the laryngeal inlet. So the main muscles are oblique arytenoid and aryepiglotticus muscle. So here you can see oblique arytenoid muscle, which is extending in the, it is present in the aryepiglottic fold, just below the aryepiglottic fold, called as oblique arytenoid muscle, which is extending downwards and is extending downwards. It is extending from the hyoid bone, just below the hyoid bone. These are very thin muscle fibers. You no need to remember the origin and insertion of it. Just remember that oblique arytenoid which is present below the aryepiglottic fold. Then, so oblique arytenoid and aryepiglotticus muscle. These two muscles are responsible for the closing of the laryngeal inlet. Closing the thyroepiglotticus muscle. Thyroepiglotticus muscle, which is extending from the internal surface of the laminae of the thyroid cartilage and extending upwards and backwards, and it is reaching to the aryepiglottic fold, where exactly at the lateral ends of epiglottis. So this muscle is responsible for the opening of the inlet. The muscles that abduct or adduction of the vocal cords. So this is very important muscle called as posterior cricoarytenoid muscle. So this posterior cricoarytenoid muscle, which is responsible for abduction of the vocal cords. Abduction of the vocal cords. Here you can see that posterior cricoarytenoid muscle. So it is extending from the laminae, two depressed areas which are present on the laminae of the posterior surface of the cricoid cartilage. It is extending upwards and it is reaching to the muscular process of arytenoid cartilage. When you see the muscular process of arytenoid cartilage, you have to remember that it is the lateral process of arytenoid cartilage, which is projecting laterally. That is nothing but muscular process. Whereas the anterior process, which is facing anterior, that process is called as vocal process. So this posterior cricoarytenoid muscle extending upwards and laterally and reaching to the muscular process of the arytenoid cartilage. This muscle is responsible for abduction of. So that's why it is called as safety muscles of the larynx. Why it is safety muscles of the larynx? Because posterior cricoarytenoid muscles contract muscular process of both arytenoid cartilages. They rotate medially. They rotate medially. As a result, vocal process rotate laterally. So this posterior cricoarytenoid muscle, as I have told you earlier, is extending upwards and lateral, reaching to the muscular process. When it got contracts, it is pulling like that. So that's why the vocal process, it is going away from each other. It goes away from each other, causes the abduction of the vocal cords. So that's the reason it become diamond shaped and opening of the glottis. Here you can see the posterior. And if posterior cricoarytenoid muscles got paralyzed, what happens is the adductor muscles, they takes the upper hand. Then the person might die due to the lack of air. Why? Because when abduction is not happening, immediately the muscles which are responsible for adduction, they take upper hand. So the closing of the laryngeal inlet, closing. So adduction means they closes completely. So the air does not passes inside the respiratory passage and it causes the death. So that is why it is called as safety muscles of the larynx. Okay, here you can see this. Yes, vocal process, vocalis muscles. These are the adductor. Lateral cricoarytenoid muscles. These are adductor muscles. Lateral cricoarytenoid muscles. Posterior cricoarytenoid, that is abductors, and lateral cricoarytenoid, it is adductor muscle. Lateral cricoarytenoid muscle, which is extending from the cricoid cartilage. Here you can see in this image, it is extending upwards and it is reaching to the arytenoid cartilage, which surveys anterolateral surface of arytenoid cartilage. This muscle is responsible for adduction of the transverse arytenoid. It also causes the adduction of the. Here you can see this abduction movements. Adduction, abduction. So lateral cricoarytenoid adduction, whereas posterior cricoarytenoid is responsible for abduction. And muscles that increase or decrease in the tension of the vocal cords. One is cricothyroid. It tenses the vocal cords, it is also called as tunic fork of the larynx, and it is supplied by external laryngeal nerve. Okay, this is cricothyroid muscle fiber, which is extending upwards from the arch of cricoid cartilage and reaching to the inferior border of the inferior border of the thyroid laminae, and it is supplied by. You can see that movement of it. Then vocalis muscle, it tenses the vocal cords. It is supplied by recurrent laryngeal nerve. The segmental tension of the vocal ligament helps in the thyroarytenoid muscle. It relaxes the vocal cords. Thyroarytenoid muscle extending from the internal surface of the thyroid laminae to the arytenoid cartilage. So that is thyroarytenoid, which is responsible for relaxation of the vocal cords. The mechanism of phonation. So the larynx is like a wind instrument. When you see the wind instruments like the saxophone or the flute, these are the wind instruments. So they need the air. So from where the air is coming, it is coming from the expired air, expiration, the air which is coming from the lungs, exhaled air, which is responsible. So here also the larynx also working in such a way that like a wind instrument. Vocal cords are kept adducted. First, the vocal cords are kept adducted. So, which muscle is responsible? Lateral cricoarytenoid muscle is responsible for adduction. So, first the vocal cords, they will be closed, means adduction. Then the air reaches to the laryngeal cavity from the lungs, and then the air pressure will increase. So, how the air is coming upwards and reaching to the laryngeal cavity? Because of the abdominal muscles, intercostal muscles, and other expiratory muscles, even the diaphragm muscle. Force of the air opens the cards. The force of the air opens the cards and is released as a small puffs. When you see the vocal folds, they are present below. Vestibular folds, they are present above. So first the air reaches to the laryngeal cavity and that air pressure will increase. It opens the vocal folds. Then immediately the air, it does not completely, the pressured air does not enter all of a sudden, but it enters like a small puffs. So sound is amplified by mouth, pharynx, esophagus, and nose. So this exhaled air, it is passing through the vocal cords and it makes them to vibrate, producing the sound. And sound is converted into speech by modulatory actions of lips, tongue, palate, pharynx, and teeth. Here you can see in this image. So first the vocal folds were closed. So slowly the pressured air, it is making the vocal folds open slowly. In the second image you can identify very small space. So through this small space, the air enters into the cavity, laryngeal cavity, in a small puffs. Again, in this video, I'm just showing
The
you
larynx
how
is a
the
critically
air
important
enters
structure for both
inside the
life
laryngeal
and for
cavity.
speech. It is buried deep in the tissues of the neck.
Yes. Here you can see the
The
larynx.
larynx is made up of a series of cartilages placed atop the trachea. The cricoid cartilage sits immediately on the trachea, and the thyroid cartilage articulates with the cricoid. The tiny arytenoid cartilages sit on the posterior cricoid cartilage. The vocal ligament of the vocal folds runs from the arytenoid to the thyroid cartilage. The lateral cricoarytenoid muscle closes or adducts the vocal folds, rocking them toward the midline. Phonation for speech is initiated by simultaneously starting airflow from the lungs and trachea and bringing the vocal folds closer together. When the folds move closer together, the air pressure between them drops, and the vocal folds are sucked into the airstream and are pulled closed. The air pressure beneath the folds blows them open, but they are pulled back together by elasticity and the negative pressure of the Bernoulli effect. This cycle is repeated over and over until the vocal folds are abducted or removed from midline. When you look at the vibrating vocal folds in cross-section from behind, notice that they open from the bottom to the top, and that they close from the bottom to the top. This is a critical contributor to the complex acoustical phenomenon of voice.
So that is how the air, pressured air, opens the vocal folds and enters into the laryngeal cavity, and this process will takes place in the phonation. The loudness of sound depends upon the amplitude of vibrating vocal folds, whereas the pitch depends upon the frequency with which the vocal folds vibrate. Since the vocal cords are usually longer in males than females, they vibrate with greater amplitude but with a lower frequency. Hence, voice of male is louder but low pitched. The clinical aspects of it is vocal nodules or singers nodules or screamers nodules. Why this? It's also called as teacher's nodules. During the vibration, the area of the maximum contact between the vocal cords is at the junction of their anterior one-third and posterior two-thirds, and thus subject to the maximum friction. Hence, in individuals who overuse their voice, such as teachers or singers, the inflammatory nodules may develop at these sites called the vocal nodules. So, how they appear, they small pin to split pea shape. In early stages, they appear like a soft reddish and edematous, but later stages it becomes grayish or whitish in color. So that's about the teachers the laryngoscopy. So the interior of the larynx can be inspected directly by laryngoscope or indirectly through a laryngeal mirror. So through the by the help of the laryngeal mirror, we can they're passing through the oral cavity, and we can see first the base of the tongue. Then we can identify the vernacular, the depression between median glossoepiglottic fold and lateral glossoepiglottic fold. Then we can identify the posterior surface of the epiglottis and the upper end of epiglottis. Then you can identify the ariepiglottic folds, right and left ariepiglottic folds. Then you can identify behind that we can identify the pyriform fossae, right and left pyriform fossae. Then you can see the false vocal folds or called as vestibular folds, or they appears like a red and widely apart. Then true vocal folds which are medial to the false vocal cords. Then other thing which we can identify between the vocal folds and the vestibular folds, this gap is called as sinus of the larynx can be seen, and these are the structures we can identify from superior to inferior. Here you can see, yes, vocal cords how they appear. Carcinoma of larynx. Laryngeal cancer is a type of a throat cancer that affects your larynx. What are the symptoms in the larynx cancer is hoarse voice, breathing difficulties, excessive coughing, cough with blood, neck pain, sore throat, ear pain, trouble swallowing food. These are all the symptoms you can identify caused by chronic alcoholism or exposure of asbestos, toxins, or it might be caused by genetic diseases like a fact of this larynx class. Thank you for your patience, guys.